I'd like to welcome our patient panelists to the stage. We have Louis, Lisa, and Tiffany. And before we get started on the panel discussion or panel questions, please note each desmoid tumor case is different. These conversations are not intended as medical advice and should not be used as a substitute for professional medical advice and services. This is 3 patients' experience, and we hope that, that this is good information for you. These experts will share about their journeys. I just have a few questions for them, and then we'll open it up to a couple questions from the audience. So I'm going to ask each of the panelists to share a little bit about your journey. Louis, do you want to share first?
Hi, my name is Louis, and my tumor's name is Norma. And Norma is quite literally a pain in my ass and thigh and knees and whole leg. I was diagnosed back in 2019, pre-pandemic, right before the pandemic hit. I was diagnosed, somewhat ironically, I had gone to my doctor with severe back pain, which I've had chronically my entire adult life. And I insisted on a scan because the pain was different this time. And of course, she recommended physical therapy, which they always seem to recommend. I said, no, I really want a scan. And it turned out that there was a mass. And at first that was diagnosed as a malignant sarcoma, which was a pretty bad diagnosis. And I lived with that for about 2 weeks, preparing for my death and kind of getting comfortable with that. And then I was informed that it was a desmoid. So at that point, they ordered a very extensive MRI, and they discovered that the pain I was experiencing, the good news and the bad news, according to my oncologist, the good news was that the desmoid was not causing my pain, but I had severe spinal stenosis. So it began a kind of combination process of 2 different kinds of pain. And I eventually had surgery for the stenosis. And over the years, the desmoid pain has taken over because it has grown quite large. It's about 10 inches long by 5 inches wide. So it's quite a lump in there. And as of this point, I have not been on any kind of treatment at all for the tumor. Various pain medications, some of which are more effective than others. Nothing really takes the pain away. So I think, are we going to be talking about pain more later on, or do you want me to talk about that now?
I would just touch on, give like a 30,000-foot view now. I'll ask you about pain later.
Okay. So that's about it. It's been 6 years of living with this. And fortunately, I know for a lot of people, it's been really life-changing. For me, it's been what I would call life-annoying. I'm very fortunate I have been retired for quite a while, so I don't have to worry about the really bad days going to work. And as I said, it's more of a literal pain than anything else.
Okay, thank you. Lisa, do you want to go next?
Hi, my name is Lisa Gray, and I'm from Michigan. I was diagnosed with a desmoid tumor in my sternocleidomastoid muscle right here. My journey began 3 years ago with neck pain and visible swelling, which led to numerous visits to many different doctors. I had CT scans, x-rays, ultrasounds, MRIs, all with different doctors, and 2 failed core biopsies before getting the right diagnosis. And that happened probably a year later with a hematologist that I went to see, who I was connected with, and then he ended up sending me to an oncology ENT to have an open biopsy. Learning about the tumor's locally aggressive but benign characteristics after having an open biopsy was confusing and challenging both at the same time. I found it very difficult to explain to others, just exactly what I had. It was really difficult, I think, in the way that when I told people, they would say, well, you look fine. And so that's the response that I get a lot of times. I quickly immersed myself in researching desmoid tumors online, and I stumbled upon the DTRF, thank goodness. I began researching sarcoma doctors, sarcoma centers, conventional therapies, holistic approaches, and desmoid tumor groups, just to help me navigate some of the things with the disease. My treatment involved consultations with several different specialists, and I faced complicated decisions, as we all do, about whether to pursue medication, observation, or different therapies. It has been a journey of anxiety, uncertainty, frustration, and adaptation, requiring ongoing follow-up and communication with my traditional and holistic doctors, both who don't really communicate with each other, so that requires more participation on my part to be more engaged and to be more knowledgeable about what I can and can't do. It would be awesome to have doctors who are willing to communicate with each other for the good of the patient, to figure out what works and what doesn't, and to have insurance that pays for some holistic approach if you chose to go that route. And I think there's a lot of people who just don't know enough about holistic therapies to maybe even know what to look for. So I think that would be really helpful. Advocacy and fundraising have now become an important part of my life, and not just for myself, but for all of you too. So that's why I'm here.
Thanks so much, Lisa. Tiffany, you want to share with us?
Sure, I'm Tiffany Braswell. My tumor is in my left thigh and calf. I first noticed something was wrong with my leg in 2016, and by May, I began to seek medical attention. My leg would often give out and felt very weak. I went to the emergency room and an x-ray was ordered. The findings from that x-ray showed patellofemoral. I was advised to do physical therapy, which I did for a year. However, due to financial reasons and no progress, I stopped physical therapy. I remained in pain and saw no improvement, leading to that discontinuation. Without answers, life went on. Then the pandemic hit and life got away from me. Meanwhile, my leg continued to increase in size and my range of motion became severely limited. I was in pain every day. I began to feel like a prisoner in my own body. By May of 2024, I decided to take back my life. I scheduled an appointment with an orthopedic specialist who ordered yet another x-ray. The results showed nothing of concern. At that point, I pled for an MRI, which was finally approved. The MRI revealed masses in both my left leg and left calf area. My orthopedic specialist referred me to an oncologist who ordered a biopsy of my leg in June of 2024. Following 2 biopsies, both masses were confirmed to be desmoid tumors. In August of 2024, I began a targeted chemo drug. While my quality of life has improved significantly in terms of pain management, I have been struggling with cognitive delays, which has taken a toll on my mental health.
Okay, thank you so much, Tiffany. Okay, so I just have a question for each of you, and then we'll open it up. This one's for Lisa. So Lisa, how have you advocated for yourself in the doctor's office?
I've learned to ask a lot of questions, seek second and maybe even third opinions. I've never given up in all the situations that are so frustrating, especially during the year, a little over a year, that I went to multiple doctors and couldn't get an answer. Everybody kept telling me I was fine. So I've tried traditional and holistic to see which improves my overall results and keeps my pain at a point that's bearable for me. I keep copies of all my records. I list all my supplements that I do, all my medications, and just try to stay informed about new treatments and trials that are out there, how different medications and therapies affect other desmoid tumor patients. So I go online and look at all the Facebook posts and, just get some information that way, which really helps. Finding and connecting with the community of other desmoid tumor patients, and I feel like that has been really empowering, especially this weekend. I've learned the most by asking other patients questions and reading what works or what didn't work for them. And I've also tried to educate my healthcare providers about my experiences, both in the holistic and traditional area. And I sometimes find myself going in and researching and providing that information to them because they just don't know enough. So that has helped me a lot too.
Okay, thank you, Lisa. My next question is for Tiffany. Can you talk a little bit about how being connected to the larger community has changed things for you? So how has your life changed and how have you changed?
Sure. Excuse me. Being connected to the larger Desmoid tumor community has shifted my experience. When I was first diagnosed, I felt isolated, confused, and overwhelmed. Desmoid tumors are rare, and it's hard to find people who really understand what you're going through. Connecting with others who live the reality gave me a sense of belonging that I didn't realize I needed. My life has changed because I no longer carry the weight of this diagnosis alone. I gained knowledge from people who walked this road before me, and I found support in moments where my own strength felt stretched thin. It has made the journey less more about why me and more about we're in this together. I've changed too. I've become more resilient, more vocal, and more compassionate toward myself. I've learned to advocate not just for my health, but for awareness and research that helps others. I've shifted from seeing this diagnosis as something that only takes to also recognizing the connections, courage, and purpose it has given me.
Thank you. Thank you so much, Tiffany. And Louis, here's a question for you. Can you share, you said before, to me, desmoid tumors aren't life-altering, they're what did you say? You said annoying. That's what you said. What's working for you? Because it sounds like your life hasn't changed that much because you're retired now.
Right.
So you can do. So tell us a little bit about what's working for you.
Well, I think pain is a very subjective thing. And so I can't speak to anyone else's experience of their pain. I can only talk about my own. And I have been told that I have a very high tolerance of pain. My husband would probably disagree with that. I don't like to think of myself as stoic, but I don't like to present as a person in pain. So I think that's part of it, is sort of an act as if, or I guess it's also referred to as masking, I've heard. So those techniques, and I think if you present yourself enough like that, you start to believe it yourself to a certain degree. I also find that distraction and adrenaline are the two very best painkillers for me, and I've tried a lot of different painkillers. But I find that when I'm excited by something, that I don't notice the pain. And the first time I realized that was right after the diagnosis, which was in the end of 2019. I was scheduled for surgery for my back in March of 2020, and of course that didn't happen because of the pandemic. But in January, I'd gone to San Francisco, where I had lived for 9 years, many years ago, back in the 90s. And I was really afraid of going back there because I was in such pain at the time that I could really barely walk. I was bent over. I thought, now I'm going to be in a place with all these hills. Well, going back there was a very positive experience, and I found that as I was walking around and being very distracted, I was not in any pain, and I was walking very differently. And as soon as that trip was over and I went back to normal life, the pain returned. And that's been a pattern over the last 6 years is when I'm engaged, when I'm really enthusiastic about something or excited about something, I just don't, the pain is there. I'm sure it's there, but it's not significant if you're not paying attention to it. So I try to be engaged in life. When I'm bored, when I'm not doing anything, when I'm just lying around sort of feeling sorry for myself, the pain increases to an incredible degree.
Okay, thank you so much, Louis. So I am finished asking my questions. I'm going to hand it over to you. So if any of you have questions, you can go to the mics and pose them yourselves. And then you can, if you want to ask a certain person a question, obviously you can speak to them specifically. Don't take it personally. All right. Do you have a question, Shani? Okay.
I've got a question for you guys. Thank you again for being here and for taking the time to not only tell your story, but prepare with our team before you got here. So a little behind the scenes is we not only reach out to folks, but we help them along the way. But you help us way more. So I would just ask, to anyone in the room that might be afraid to like connect more online or in person with other desmoid patients, what advice would you give them about taking that first step?
I guess for me, I would say when I was first diagnosed, I felt very alone. I had no one understand anything that I was dealing with. So I guess my advice would be just put yourself out there. There aren't many of us, and you'll find someone like me who is trying to connect with as many people as I can. So yeah, it's definitely not for the weak, but put yourself out there and you'll find your people. So I really appreciate us being able to break off into those groups by tumor location, because that definitely helps.
Thank you. Does anybody else? Lisa, do you want to?
I think for me, I really researched before I started asking questions because I didn't really know what to ask. So I think that was, for me, the biggest thing is just making sure that, you know, I looked in all these different places for the information that I needed, and then I could kind of go from there and ask the questions that I really needed to ask.
Yeah, I think I learned a lot more online than I did from my doctor.
I have a question specifically for Lisa. My wife also enjoys a holistic approach when it comes to the desmoid tumors. Do you have any particular resources that you utilize?
Well, I see a holistic doctor, so I do everything through my holistic doctor. However, I do a lot of research. So there are times when I go to my holistic doctor and I say, what about this or what about that? There are times when she has given me specific supplements to use, and I spend the time researching those things before I take it. And I have found on one occasion where I shouldn't have been starting it, and luckily I ran that by her before I started. So you definitely have to advocate for yourself.
Thank you.
Mm-hmm.
Thank you for that question. Anybody else? Okay, let's give our panelists a round of applause.